Practice of Health survey that was done by the Fauquier Free Clinic, and how they address the whole holistic picture of health and how mental health and physical health work together. And then Ellen Adams is going to talk about the therapeutic process and different journeys or approaches you can take, and especially the relationship we should all establish with ourselves. And then Kathy Weigel of NAMI Piedmont is going to talk about the benefits of support groups and what options there are for family and peer education groups and how they can get that process started. And then Renee is going to tell us about the current programs that are being led elsewhere in the community and other programs that are coming down the pike. So I'll get us started with some data. I'm sure we all know that at least every other day lately, there's been a new article about the crisis in mental health. So we just want to look at some of those numbers. In February 2021, 36.9% of adults in Virginia reported anxiety or depression, and only 22% were unable, and 22% were unable to get needed counseling or therapy. In Virginia, 1,243 lives were lost to suicide, and 267,000 adults had thoughts of suicide in the last year. And this is very recent data from NAMI in 2021. Regarding youth, suicide is the second leading cause of death for middle and high school aged youth, and we are losing a young person to suicide about every 2 days in Virginia. 56.2% of Virginians aged 12 to 17 who have depression did not receive any care in the last year. And that's recently released information. From 2016 to 2020, I'm sorry, reading really fast. From 2016 to 2021, there were more than 58,000 self-harm emergency department visits from children between the ages of 9 and 12, and the number of visits more than doubled from 2016 to 2021. Combined with this urgent need, we have workforce shortages and uninsured. We have most of Virginia is federally designated mental health professional shortage areas, and almost around 10% of Virginians under 65 are without health insurance, yet they are eligible for Medicaid. Although a lot of providers don't accept Medicaid, so that's another part of the problem. So just here locally, we have heard that 19% of adults in Fauquier and Rappahannock are facing social isolation. The Warrenton Sheriff's Office responded to 75 overdose calls in 2021 alone. And there's a 3-month average wait to see a mental health provider just in Rappahannock and Fauquier. Also, Youth for Tomorrow is at 100% capacity with 5 counselors working full-time just in their Warrenton location. And there's, we'll say a 4-day average wait, but I've heard up to a month for wait in an emergency room for a psychiatric bed for youth. So all that being said, I'm going to turn it over to Alan of Rappahannock Rapidan, and he's going to address some of the programs that are that are being developed out of our Rrcs prevention.
Hi, Bridget. Thanks for the handoff here. So I am going to talk a little bit about Rrcs Community Services Board, and you can look this up online as well, but I really talked to Bridget and Renee about focusing on what prevention is doing. Since I'm the prevention manager for Rrcs, I did want to share some of the information there as well as an overview. So just briefly about Rrcs, because I've got 10 minutes here. We do have a clinical services division, with the infant toddler connection, the behavioral outpatient services, young adult coordinated care. These are some of the programs, children's behavioral health support. And, there's, again, substance abuse and mental health outpatient services, youth substance abuse treatment there. And again, if you go to rrcsb.org, you can see the programs. We also have the Boxwood Treatment Center, which is an inpatient program for alcohol and other drug treatment, detox services. And we have outpatient-based opioid treatment through the clinical services. We have an aging and transportation division, as well as a community support services division. And all these programs are listed online, but the Bridges Day Support Program, the Visions Clubhouse, for those with mental illnesses, and programs such as that. So what I wanted to do at this point, I'm not rushing along here, but I am going to share my screen, and I want to talk about the work that actually is being done in RRCS prevention. Not that it overshadows this one team, one program, one fight. We're all in this together at RRCS, but I'm the manager of prevention, and I like to get this information out. So I do want to note, hey, we are celebrating our 50 years of service. We actually have a great event on September 29 that we're going to be celebrating as a community partner with other community members, our agency, and the work that's being done. I do want to share that our RRCS prevention team. Now, I got to tell you, I know I'm short for time, but for many years I worked alone or with a part-time person. So I'm proud to say that RRCS has invested in creating a prevention team. I was elevated to prevention manager. I work under Taisha Chavez. I'm under children's services. So it's children's services and prevention. I have Chelsea Moore, who's a prevention support coordinator, working full-time with me, as well as Ellen Chamberlain, a recently hired individual who is a prevention clinician. So we have a nice team evolving, and I'm very happy. I got to tell you, I'm excited to be on that team. Now, I wanted to share programs that we're doing, and I broke it down by funding, actually, because I use this in other presentations. But when we look at, we have block grant funding, and we have some state opioid response funds. I'll talk about those programs in a minute too, but I think you might be surprised how much prevention does. I think you will be. So I do gatekeeper training, which is a suicide prevention. I do it, QPR, and I also in the schools doing a helping friends presentation, but it teaches people to recognize the signs and clues of someone who may be thinking of suicide. Maybe they're just in distress, but that's the prevention piece. You head this stuff off, recognize, can link people to help. So, and again, over the years, I've trained over 50,000 adults and young people as gatekeepers in our 5-county area. I'm proud to mention that number. We also are involved in mental health first aid, Chelsea Moore and Ellen Chamberlain, along with Renee Norton. They're going to be working together to do mental health first aid programs, and have been doing it in the community. Also involved in adult childhood, adverse childhood experiences, the ACEs training, and do those presentations. So I'm mentioning this. If you guys ever want a presentation, get a hold of me. We'll make it happen. I'm proud to say a new initiative with RRCS prevention is the Zero Suicide program. We are going to train all of our staff to be gatekeepers, and we've done an overview presentation, and that's about client safety, suicide safer care for our clients, as well as our staff. We're going to watch out for our staff. It's a national program. So I am involved big time. We are in doing community presentations, resiliency and life skills trainings. I have a whole series of trainings. A lot of them are on YouTube, actually, or with VCE, Virginia Cooperative Extension. They're published, but we do the Lock and Talk program, which is a prevention program about firearm, medication, safety. We give out lock boxes for medication and firearms. We have cable locks and trigger locks that we give out to community members to help protect individuals, keep guns safe and medication safe. Gambling and gaming prevention. This is a new program we're in. We've already had through consultants, every location in our 5-county area that has lottery tickets or any gambling has been environmentally scanned and assessed. So we're going to be doing some prevention programs later. And, you know, I always say I'm going to have to take on the Manning family because they're in all these ads promoting gambling and stuff. So I got a tough chore ahead of me. So marijuana prevention is on the table. If they legalize it, we have programs to prevent it. So that's one of my statements. It's gambling's been legalized, marijuana, so we're going to help prevent it. And then Too Good for Drugs and Violence is a substance use program. And then the big one here, counter tools merchant education. We're still on into tobacco prevention big time. So we are, I'm hiring a consultant to go out and provide merchant education materials and assess all stores that sell tobacco to see if we've had any changes over the year and some of the prevention work we're doing, but we're trying to work on that. So when you look at prevention programs related to the state opioid response funds, we are in a major program with doing public service announcements on opioids, medication misuse, over-the-counter prevention, you know, the facts of that. So if you're ever watching TV, we do it through Comcast. I was watching the Golf Channel the other day and popped up a suicide prevention message right there. You can see it at all times, RRCS. And, you know, and Team Jordan was in the suicide prevention. We work with coalitions. We actually have a suicide prevention one, as well as a Stop the Stigma campaign in partnership with Crush Coalition. So look, I just entered the data and there we're all over the place with these ads, public service announcements. We hand out drug deactivation packets. A lot of people don't know that. So, I mean, I've given some in the past, the Mental Health Association, sheriff's departments, hospice, you name it. These are little packets. Community members can, if they just have a small amount of medications, they want to dispose of it safely, they can use these packets. So just reach out to me if you need any of that. This is all community based. You know, it's not, I'm not hoarding this stuff. I'm going to give it out. We have prescription bags that go out with Remington Pharmacy, actually, and I'm looking to get other pharmacies, but when they give out medications, we have these bags that advertise permanent drop box locations for disposing of medications. And there's also information on where to get help for substance abuse. So, and I mean, we're talking thousands of bags in a month, couple of months. So permanent drop boxes, we promote those. And there's, you know, on those locations so people can dispose of their unused medications. And we collect the number of pounds and enter that into a database for the 5-county area. And a big piece of SOR, just like the block grant, we do community presentations on substance abuse. You know, I go out and do this a lot as recently at Wakefield School, Country Day School, doing a presentation. And then we also, I'm proud of this. We do community partner prevention support grants. We have funds each year. We just gave out 13 grants. A number of the community partners in Fauquier received $1,000 grant and in other areas too, but this to do prevention programs. And so we're excited about that. And we also are involved in the Revive training. You know, Christy South, Chelsea Moore, they're involved in that as well. So anyway, last thing I want to show here, here's a list. We are big time. You got a lot of you don't know me from the beginning. I started in 2003, and the first thing I was told is get coalitions, get coalitions. It's one team fight. You can't do it by yourself. And so I embrace that, man. I embrace it big time. I'm involved to help Team Jordan set up. They're actually a coalition of those who have lost a loved one to suicide, Chris Jenkins and his family. And so, you know, when you get survivors doing this stuff, it's impactful. We have a Survivors for Life support group that I do the first Monday of each month at 7 p.m. for those who lost a loved one to suicide. Crush is in there, Living the Dream Foundation, Rusty Bowers. You know, again, those are survivor families that came to me and we said, let's set up a coalition. Big time healthy Culpeper, the main group, you know, Denise runs out here in Culpeper. They have a teen empowerment coalition. I'm chairperson of that. They also have an early childhood work group. And then, you know, big time mental health association. Look at us, we're working together, trying to do big things, and always been involved with mental health association. Partnerships, PCR, Safe Supportive Schools that meets during the school year in Orange, Rappahannock Roundtable, Madison Strong. You know, they stopped when COVID came, and they are now going to be re-meeting and setting up meetings. So anyway, we're big into coalition groups. We're big into presentations and outreach. It's that one team, one fight. Now, last thing I wanted to say, we have this major database. We track all of our prevention activities, and we do this very well. I don't mind celebrating that. When you talk to the data people, they say we're on top of that game, and I like being on top of that. So you look at the numbers, who you're reaching, the programs you do, it's all in there. And statewide, nationwide, but statewide, we're looking pretty good. So I always, you know, Bridget said maybe to mention this, and I think it's a good idea. You know, with the regional call center, we used to call 825-5656. You can still call that number, hit extension 7, but you know, if you need services, emergency down to just help, we now have a regional call center number. You know, our crisis services guy, Ashton Moore, says, get this number out there. So this is a number we're going to be promoting. And I do, you know, I want to take one more second. I know I'm running maybe out of time, but I'm going to stretch it and press it. You know, this zero suicide program, I mentioned we are training all of our staff to be gatekeeper trained. We are also continuing to do that in the community. It's one of the biggest steps any community can take, is to get that QPR. It's a simple, short presentation, teaches people to recognize someone in distress, how to talk to them, see if they're thinking of suicide, then link them to help. And also, I'm doing it with students still, and because I have story where students have been trained in helping friends, and they identify another young people. You heard the data about young people. We need to get everybody involved, youth and adults, to help make a difference. So anyway, I'm going to pass the torch to whoever's next on here. If you, one thing last, if you have any questions, you can write us at prevention@rrcsb.org. Taisha Chavez or myself, we will respond to you, no doubt. So I'm going to stop share. And I appreciate the time and the opportunity to talk to everybody.
Thank you, Alan. Let's see. I think now we're going to turn it over to Shannon from Fauquier Free Clinic.
Thank you, Bridget, and thank you, Alan. It's always great to have such a reminder of all the amazing work you guys are doing. And when this is over, please make sure you guys are keeping an eye on that inbox, because I'm going to be sending an email requesting some of those bags that you were referencing, because we do have a med center here at the free clinic. And while we aren't dispensing any controlled medications, it doesn't mean our patients don't have them in their homes. So I'll be reaching out and making that request. So I always learn something new from you about the great work you guys are doing. So thank you. And then Bridget, I know you had some slides for this part of it. I don't have a presentation to share. I wasn't that on it.
There's more discussion. I just have some introductory, just little focus points. I can bring those up just to guide the discussion.
And while you're bringing that up, I will go ahead and share for folks who don't know. The free clinic, has made a shift in the past year to, in addition to providing the integrated care, medical, dental, and mental health services, we have really been focusing on gathering data about the social determinants of health that our patients are experiencing. So for those of you who are maybe unfamiliar with social determinants, the CDC defines social determinants as conditions in the places where people live, work, and play that affect a wide range of health and quality of life risks and outcomes. So what we know is, for all the mental health background folks, we're talking about Maslow here. Before we can really jump into making sure patients can focus on their medical needs, mental health needs, dental needs, and those treatment plans, we want to make sure those basic needs are met. How can a diabetic patient manage their diabetes if they don't have a refrigerator to keep their insulin in? How can we focus on resolving complex intergenerational trauma if I'm sleeping in a tent and they're calling for torrential rain and downpours? How am I supposed to call the regional crisis line if I'm experiencing a crisis if I don't have a phone? How am I supposed to access healthcare if I don't have transportation? So over the last year, we have implemented a survey, the Prepare survey, asking our patients what are their needs. And we are continuing to do that this year. So we do have a year's worth of data. I'm not going to go through and share the full presentation, but some of the points that surprised us the most were, one, how many of our patients were at risk of social isolation? How many reported that they had less than 2 to 3 significant interactions with close individuals each week? Last year, that number was around 19%. So far this year, we're on track to kind of hit that percentage as well at about 16%. The main needs that our patients identified, well, let me back up a little bit. The Prepare asks questions like, what's your highest level of education? Are you employed? Are you looking for employment, or are you unemployed and not looking for a job, perhaps due to disability or something like that? They ask, do you need childcare? Do you need medicine? Can you access healthcare? Can you clothe yourself? Do you need food? Do you have the means to pay your rent and your utilities? And it hits all these major points. Have you had legal involvement in the past year? Because we know that that can make a significant impact on the ability to access emergency housing or jobs. So the big ticket items that we find ourselves responding most to for our patients is food insecurity. So far this year, out of 361 patients surveyed as of this point this year, 16% of those patients have had food insecurity. 10% have not been able to pay their utilities. 14% have been unable to access clothing for themselves or their family members. 9% do not have a phone or service that they can access. 15% have transportation barriers. 13% of our patients are homeless right now, and 16% have housing instability. So they may be couch surfing, they may, be in an emergency shelter, but it's not permanent. 16% say they don't have access to the healthcare and the medicine that they need. 16%, again, as I said, are at risk of social isolation. And, Renee has done a great job of educating us on the health impact of loneliness, and I don't want to misquote the data, but, equating it to packs of cigarettes a day in terms of the impact of loneliness on our physical health. That doesn't even get into the impact of loneliness on our mental health. And 44% right now of our patients report feeling stressed more often than not. So what do we do with that data here? We don't say, wow, that really stinks. Good luck with that. Thanks for sharing. Right. As of last year, our procedure was to reach out to patients who asked for help. So the final question was, if you've marked anything on this survey and you want help identifying resources, let us know. And then we would contact those patients individually. We would go through their responses, what they reported their needs were, and link them to appropriate community resources. My big dream this year is to, really just get more up in their business and not even ask them if they want help, because sometimes that part was left blank. Sometimes there was a fear and the stigma of what happens if I say yes. If I say that I'm housing insecure or I'm food insecure and I'm also a caregiver of minor children, does that mean you're going to call social services on me? So I'm not going to tell you that I want help, or I'm not going to respond. The big one also that we want to address in real time, because we have integrated care, is these individuals who are saying that they can't access their needed healthcare and medication. Are there resources that we have in-house that they aren't aware of? Are there specialists involved in their care that somehow we haven't known about? So our hope is to start getting these surveys in our hands while the patient is still in the building. It's very difficult to call a patient to follow up with resources when they don't have a phone or they don't have transportation. And then we are just, kind of stalking. We're stalking. I'm going to call it what it is. I'm watching the schedule and I'm waiting to see when that patient has another appointment to kind of pounce and say, we've been wanting to reach you. We can get some resources for you. So that has been, another layer of the services that the free clinic is offering. Most of these needs, we're able to get them connected to someone and they report getting a resolution. Some of the biggest barrier, honestly, right now is housing. We do not have adequate housing, whether it's emergency shelter, especially for our single men with any kind of criminal record. They then end up in this catch-22 of needing shelter, but they don't have transportation. But we could get them into the men's shelter in Front Royal or Winchester, but then they have to get there and then they have to get back here because this is where their job is. And then does that mean they lose all the services for the free clinic? Because now you're out of our catchment. So we really, that is something that has been just a huge struggle for us to help our patients with. We make a lot of referrals to Hope Heals. If you guys aren't familiar with Hope Heals Community Free Store, they are amazing. They are angels in our community. They have consistently gone above and beyond for our patients. It is what it sounds like. It is a store and everything in it is free. They have baby clothes, they have adult clothes, they have linens, they have items for your home. So we have, we've made a lot of referrals there. And if they don't have an item that a patient needs, those items miraculously just quite literally show up at our doorstep. They go and get the info, get what the patients need. And all of a sudden I have a tent being delivered for our homeless patient who's been staying in a tent, but her tent is leaky. We have wool socks for the gentleman who showed up, who's been sleeping in his car all winter and got frostbite. I can't say enough kind things about Hope Heals. We also refer a lot of our patients to the government funded phone. A lot of folks still don't realize that it's not called SafeLink anymore. Now it's referred to as QLink. The process is not simple. I'll be very honest. It's confusing for us as professionals, so I can understand why community members might have a hard time accessing it. But essentially, if an individual has Medicaid or their children has Medicaid, they are going to qualify for either a free phone or a free tablet and the service, unlimited data, talk, text for up to a year. Then they have to reapply. So that has been a huge resource in addition to Community Touch, People Inc., People Helping People, everything in our amazing community resource manual, Rappahannock Benevolent Fund. The other barrier that we experience in the hard conversations that we have with utilities and things like that are that a lot of agencies aren't able to step in until there's a cutoff notice in place, and our patients are trying not to get to that point. And especially with COVID, it took a lot could build up, bill wise before you got that cutoff notice. And so then it kind of made it even harder to get aid because now there's this huge bill. But those are the things that we've been focusing on this year, in addition to the integrated care that we continue to offer. So, we still offer full medical care, full dental care. We are open now 5 days a week. For those who may not have known, our medical clinic is now open Monday through Friday. We have a doctor here every day. Same with our dental clinic. We're in the process of renovating and expanding our dental clinic so that we are able to meet the ongoing need for our community. Mental health clinic continues to provide individual therapy and psychiatric care. We offer telehealth services. We do have one volunteer therapist for face-to-face services. We are continuing to allow patients to log in from home, recognizing all the social determinants I just listed of transportation being a barrier, stigma still being a barrier. And patients, of course, are always welcome to come here for their visits as well if they don't have reliable internet, if they don't have a safe place at home. And speaking of a safe place at home, that is also an item on the prepare that we do, that we do question as well is do you feel safe in your home? And so we've also been making a lot of referrals to the Fauquier domestic violence advocacy group as well. That was a lot really fast, Bridget. You thought you were talking fast, but like I can get it. So if that was too much too fast, you guys please let me know. And of course, if you have any questions.
Thank you so much.
Thank you, Alan. I saw that.
Things, and we so appreciate everything that you're doing. So next we're going to turn it over to Ellen Adams, and I'm just going to share my screen to just an overview of the topics that she's going to be talking about. So Ellen's going to talk about what you should know about therapy, the power of your relationship with yourself, and what are some ideas for overcoming barriers when seeking help. And Ellen, welcome and thanks for joining us.
Thank you, Bridget. We're great to be here. Some hard acts to follow there, but I will do my best. As Bridget said, I'm Ellen Adams. I'm now in private practice with River Oaks Counseling and Wellness. I provide telehealth services to adults, but prior to that, I worked for 16 years for Rrcs in the Culpeper Clinic, providing individual and group therapy to folks dealing with mental health and/or substance use issues. So I have a lot of experience in the field, and I just want to share some of my insights about the therapeutic process that I hope are helpful in some way as we work in our communities to try and help people access services and also, create more services or ways for people to get the help that they need. So just a few basics here. Therapy, which is also called psychotherapy and counseling, is the process of meeting a therapist to make changes that will hopefully improve one's life. Generally, it involves setting goals to change behaviors and or beliefs that are not working and to build on those that are already working. Ideally, in my mind, therapy is a process that you engage in over a period of time. And once you've met some goals and had some success, then you leave therapy knowing that you can return whenever you need to work on issues again. I found a really interesting thing happens. It seems that from when people decide to reach out for help, the change process already starts happening. So by the time I meet them, often some of the things that they've been struggling with have already kind of loosened up and they're already starting to take on a different shape in their lives. And I find that really fascinating. One of the most valuable aspects of therapy, in my mind, is having a non-judgmental ear, someone that you can share with. It continues to be surprising to me how many people feel they don't have this person in their lives. The person might be there, but they don't feel they can trust, or a lot of times people don't want to hear my problems is another thing I hear. And so just having that environment where they can feel more free to share what's on their mind, it just helps immensely. I mean, just to gain that perspective you get just from saying things out loud and, being able to bounce them off of someone who's not going to, tell their neighbor about it or anything like that can be really, really helpful. And, just the very process of asking for help. We know what a stigma there still is with mental health, with substance use, with so many issues people are dealing with. And one of the big stumbling blocks continues to be people's perception that me doing this on my own is the high mark. And if I ask for help, I'm somehow lowering myself, And so just in really encouraging people to ask for help is such an important aspect. And one of the things I like to do to counter that whole notion of, I'm better on my own, is to use the metaphor of a quarterback on a football team. And what I like to say is a quarterback is worthless if they're alone, just them, no team members. How's that going to work? And to ask clients to think about the other members on their team. So getting them to name what's already in place, and then let's think about some other team members you need to add. So we might be thinking about positive relationships, a steady job, how to get a good night's sleep, maybe adding medication as a team member. So really kind of helping them see this aspect that they need a full team. And it's not like you have a team and then you get rid of them, which happens too, right? People make changes, they do all these great things, like, okay, I'm great now I'm gonna stop doing that stuff. And so you got to keep working with your team, just like any quarterback would. So really helping to develop this holistic feel. I mean, Shannon connects a lot of those dots in her work with how important all of these aspects of people's lives, how they interplay. So really getting people to see the connection between all of these things. And in some cases, I often say, of course, I say things something like, if you're not in jail, and of course I've worked with a lot of people who are in jail, but if you're not in jail or in the hospital or dead, you must be doing something right. So let's start to look at what are the pieces that you're already doing, because it's so easy to look at what's wrong. Let's look at some of the pieces that are in place and see how we can maybe bolster some of those. And really, one of the best tools that I think we have is to look at our relationship with ourselves. That's, I think that's something it's so easy to overlook. And first of all, most of us are suffering from too much external input. The news, social media, divisiveness, left, right, and center. And so learning to turn inward and focus a little more on ourselves can in itself be a little bit of a relief if we can kind of help people see that the value in that. But even more important, I think, is the notion that healthy relationships or other healthy relationships begin with the one person we spend the most time with, okay? Robert Holden, who's with the Mental Health Foundation in the UK, says this, the relationship you have with yourself sets the tone for every other relationship you have. And here's a little exercise to kind of bring this home. He says, imagine being in a relationship with someone you didn't love, found to be deeply flawed, worthless, and not good enough. Now imagine you have to be in a relationship with this person for the rest of your life. How would that relationship feel? How would that relationship affect your thoughts, behaviors, and day-to-day life? I think that's a really profound perspective. So I have a couple resources along those lines to share with you before I wrap things up. So on this idea, so Lisa, I always get her name wrong, Lisa Najavet, who wrote about 20 years ago, wrote a fabulous book called Seeking Safety, a treatment manual for PTSD and substance abuse. And I'll put these resources in the chat when I'm done. It's a wonderful resource. It's been around for a while, like I said, but she's got a lot of great ideas there. And one of them in her chapter on compassion, she talks about self-talk and about how most of us are hypercritical of ourselves. We have that inner critic that's working full time. But she really drives home the point that harsh self-talk not only doesn't help us, it actually gets in the way of healing because it keeps us from seeing the deeper levels of what's actually occurring. And I think it's such a valuable tool that I really try and teach this to everyone I come across. And she talks about how the remedy is to learn to practice the opposite, to learn to speak to ourselves with a more compassionate voice. That the first step is to tune into our inner voice so we can actually hear what we're saying to ourselves, and then practice replacing it with strategies like, imagine that you're talking to a small child who's made a mistake. How would you speak to that child with compassion? Or saying, if I loved myself, what would I say to myself right now? So that concept is I like to call kind of befriending ourselves. And the second resource that I want to share is from Dr. Kristen Neff, who's co-founder of the Center for Mindful Self-Compassion. And she says, quote, with self-compassion, we give ourselves the same kindness and care we'd give to a good friend. Instead of mercilessly judging and criticizing yourself for various inadequacies or shortcomings, self-compassion means you are kind and understanding when confronted with personal failings. After all, whoever said you were supposed to be perfect? We learn to offer ourselves kindness when we're having a difficult time or notice something we don't like about ourselves. Instead of ignoring our pain, we can say, this is really difficult right now. How can I comfort and care for myself in this moment? And I'll just end by sharing what she recently wrote about in terms of attachment. And I know a lot of us are familiar with, secure and insecure attachment and the impact that has on us. And she talks about how we can learn to be more compassionate with ourselves as a way of providing the secure attachment that we may not have gotten as children from our caregivers, and that we can provide that sense of we can learn to kind of reparent ourselves, as it were. She says that the good news is that even if we did not feel secure with our parents or other caregivers when we were young, we can develop secure attachment as adults by intentionally practicing self-compassion. In many ways, self-compassion can be seen as a way of reparenting ourselves. We learn to value our own needs and meet them consistently. She says when we can, our sense of self shifts so that we feel worthy of love and care that we might have been lacking as children. And she just names 3 components of this. One is kindness. So a kindness attitude that manifests as love, gentleness, and warmth. 2 is recognition of our common humanity. Okay, so that's about how we connect to other people and understanding that just as we're suffering, other people are suffering too. And the 3rd part is mindfulness that allows us to be present to our difficulties rather than ignoring or getting lost in them. So I hope that's helpful. These are just some of my insights into the therapeutic process. I know I use a lot of these tools myself. It starts, I think it starts with ourselves as individuals, really. I think there's a lot that each of us can share with people and communities about what's been helpful to us as we journey, whether we're dealing with, maybe we're not dealing with transportation issues or food insecurity, but there's so much that we have in common with each other that I think can be helpful as we try to help others. So thank you very much.
Thank you, Ellen. That was awesome. I love Christine Neff, and we all need those reminders to, be kind to ourselves, and, kindness is contagious. You're kind to yourself, and it moves on outward from there. So I really appreciate those remarks and the insight. For now, we're going to turn it over to Kathy Weigel of NAMI Piedmont, who's going to talk about support groups. And I'm just going to pull up the slides again, just so we can look at the topics. So we're going to talk about what are the benefits of support groups, what types of groups and classes are available, and what else does NAMI do. And I will turn it over to Kathy. Thank you, Kathy.
Thanks for inviting me today. Oh, before I thank you, I want to thank my co-panelists. I've learned so much from you today. I've been taking notes as each of you speak. I always say you can always learn new things, and I've learned many new things today from you, and I thank you. And I thank Bridget and Renee for inviting me today. NAMI Piedmont is a very, very, and I don't know why, little known mental health entity in the community, even though NAMI, and NAMI stands for National Alliance on Mental Illness, NAMI National has been in existence for 50 years, NAMI Piedmont for close to 30 years. NAMI National is a powerhouse, so much information. NAMI Virginia, NAMI Piedmont is known as an affiliate that's tiny but mighty. I think part of us not being as known as the other mental health entities is we're run by family members and peers of dealing with mental health concerns. We have no professionals in our organization. We do not have an office. What you're seeing behind you is the NAMI Piedmont office, and I admit it right now in my home. I was going to say to Adam, make us part of your coalition. We'd love to be on it. We are a mental health entity. Anything I say today, I believe, Bridget, you have my website, my email in the chat box. Everything is in that or not my my email, but the website is in there. Anything I say today, you can find on that website. Programs, access to the NAMI Virginia website that'll give you much more. Please take advantage of all that. That's this information saying, come to me, come to me. Benefits of our support programs. Right now, support, and I think that's the best thing we're offering right now, and we offered through during COVID-19 concerns, is our peer connections group. And our peers are individuals living with mental health challenges, and our family support groups. And we have been offering them online 2 times a month. The benefits of our support groups are they are run by family members and peers. They are trained by the NAMI Virginia to facilitate the support groups. We don't just sit there and talk and tell everybody what to do. We aren't therapists at all, and we don't pretend to be. We just monitor the group. And it's not a group where people just come and complain, or somebody just takes over the whole meeting complaining. It's a group where, yeah, you're going to come in, you're going to tell your current concerns, but the main focus of the group is to give advice about your concern using your lived experience. And anybody with a mental health concern or a family member dealing with it has lived the experience of anybody sharing some. And we want to give them some of the ways we went through that experience and just give our advice, resources, whatever. So when they leave the meeting, they're leaving with something to consider, use, or perhaps expand on. We share our methods, and a lot of ways when people come, they feel we are not alone. And that brings them back, because a lot of times with this illness, they do feel alone. When their loved ones get diagnosed with this illness, people don't bring casseroles to their house or send get well cards. And they don't have that hug with other illnesses. And so this is a group that they feel gives them this hug. And it is from lived experiences. Therapy is great, and we encourage therapy. We encourage in the peer group staying with that treatment plan. We encourage that all the way. This is just another angle to support our great therapists out there. We also have many other groups and classes that support family members and peers. NAMI Piedmont right now offers the family-to-family class. That's for family members, friends of individuals with mental health concerns, and significant others. It's an 8-week, 8-session course, and it goes over communication skills, the various mental illnesses, the brain, problem solving, community resources, on and on. And it's given by us every spring. We have an In Our Own Voice program where 2 individuals in recovery from mental illness can go out in the community and they talk about their path to recovery. It's very, very heartwarming, and it's just really reaches community members. I am trained in the LEAP program, and that I have not been able to do that since COVID, and that's listening, empathize, agree, and partner, and that's good. Community members can attend that, and that is works well with individuals whose loved ones suffer with agnosia, and that's the 47.9% of individuals with mental health concerns that don't recognize their illness. But it does work with the other percentage too that are probably at the stage where they know they have it, but don't wish to deal with it at that time. We have our monthly meeting with presentations also. Youth, oh, what we have going on with youth on the NAMI front right now. If you get on our website, you can find about Youth Move, the Virginia NAMI Family Network. We have NAMI Basics. We have Ending the Silence, NAMI on Campus. In fact, we have one of those programs at Lord Fairfax College right now. NAMI Basics is a course that parents of youth can take online on their own. We're getting ready, NAMI Piedmont, to start our NAMI Llama presentation. We have the costume, and that will be going into the elementary, a mental health presentation at the elementary level, and we're going to have a booklet that goes with it. We have our NAMI llama. I don't know if you can see that, our little llama pictures for them, and a booklet, and we have the llama. It came out of NAMI's Southwestern Illinois. A young fellow by the name of Matt Gruen created it, and because he carries a llama carries the burdens of others, and we're going to shine a light with our llama on mental illness. And I just found out that llamas protect alpacas. That's why it's a NAMI llama, not an alpaca. And other, I think, against foxes, and it also protects goats and deer. So it will protect individuals with mental health concerns. So we're sort of going with that aim with the llama. We also have Family and Friends as an upcoming program that we're going to be training for, and that's a community program because many mental health specialists want to take the family course and they cannot, but this will be one that they can take. It's a 4-hour class, and it provides a binder, and it sort of gives a little tease about the family course. I also want to mention some upcoming sort of youth initiatives. One is Hiding in Plain Sight, Youth Mental Illness. That's a PBS WIDA program coming June 27th and 28th. It's a Ken Burns program, and it's going to be a 2-part, 4-hour program supporting mental health. And I've seen teasers on it. They're online. And oh, the music to it, I cried when I first heard it. It is just going to be just awesome. And it will reach the community. It's youth focused, youth speaking about their concerns. Go see the teasers. NAMI virtual convention coming up June 15th and 16th. Get on our website, $25 to register. They have a youth track each day. I was told a lot of you today are interested in youth. I hope I didn't take up too much time. I rushed through programs, but go on our website. I rattled through them, and everything I mentioned today is on there. Much more. We have NAMI now with blogs from peers, family members, and healthcare, mental health care professionals. We have NAMI Virginia that will take you to the Youth Move site, and you will see something listing all of our state-run support groups and the youth support groups, which have family support groups and youth groups. And another thing, I can run a youth family member support group if any of you can help me get it started. I've been given permission by the state. I've had a loved ones who had mental health concerns at the youth level. I am able to run one, but I need to get the word out to family members of students in the younger children's age group up to later teen group, and we can divide that into 2 different age groups. I think combining won't work. So if you can get that word out and get back to me, I can get a group started.
Yeah, definitely work on that. I think a lot of people in the community would benefit from that.
Oh, we can do it. We have the funding.
Yeah, and I also know that there's a parenting group that Rrcs is starting, the Botfin parenting skills group. I think those little efforts are going to make a big difference because, you know, a lot of it comes down to parenting principles and just connecting and
yeah, this will be pure support.
yeah, and having those opportunities available.
Yeah. Thank you, everybody, for listening today.
Really appreciate you being here. Thank you. So next we're going to have Renee Norton, who's going to talk about some of the programs that Mental Health Association has sponsored and been a part of, and then other programs that are being planned and will be implemented soon. Renee? Renee, you're on mute.
For those of you all who don't know about the Mental Health Association, we have been here since 1964, but really have come into our own, I would say, in the last 10 to 15 years. Our mission is to promote mental wellness through advocacy, education, collaboration, and increasing access to care. And so we have our hand in a lot of pots, but we do not provide direct service. And so when we're talking about how we collaborate, you know, Alan was sharing a lot about stakeholders, and we do have, you know, great relationships with our stakeholders. And so some of the things we've been a part of in the past have included like the telemental health at the free clinic. And I will be totally honest, when that was first going into the mental health clinic, the individual and I sat there looking sort of at the telemedicine sort of setup and our telemental health setup, and both of us said, this will never work. Well, guess what? All the research has shown that actually people open up more quickly using telemental health, that people keep their appointments more regularly using telemental health. And so I am glad that I have been proved wrong, that we were active in that part. We have been active in another things that are more recent. And so I'm not sure if you all have heard about the Marcus Alert program. We are one of the members of the stakeholder group or the work group putting that together. Marcus Alert is a state legislation that requires communities to have a behavioral mental health response. We were lucky that Rrcs applied to be one of the pilot sites. We are the only rural pilot site out of the groups that were chosen. And so Marcus does a number of things. As I said, it was a behavioral health response. And so separate from Marcus, there's a 988 telephone number. You all are familiar with 911. 988 is also coming down the pike. And I bring that into the Marcus Alert because that sort of is one of the first steps in the Marcus program. But 988 originally was thought about in the state of Utah. And Utah wanted to have a 988 number for people who were interested in or who are having behavioral health concerns, and so that they wouldn't have to call 911. Well, the cellular networks told the state of Utah that they couldn't support it if it was just Utah, but they would support it if it was, you know, across state lines. And so that is how it's coming down the pike. I'm not sure exactly if we've been given a date yet for it coming online, but that'll allow individuals to call that number to get a behavioral health response. Now, right now, we have a regional hotline for people. You know, you can still call 911 and they will route it to the appropriate people, but our regional number, which I will share, if you all have noticed as this talk has been going on, I've been kind of typing. I am creating a Word document that has a lot of the information that has been shared, and I will put that in the chat right before we get off, so you all can just download that and save it. And so our regional call center is, I know that Alan mentioned it, is a place for individuals to call to get that behavioral health response. That will continue, and when the 988 number goes live, then that regional call number will, of course, change to 988. Once people reach that regional call line, we actually have developed protocols to determine what level of response. Some people, when they call a behavioral health line, just need to talk to somebody, and it might take 20 to 40 minutes, and then they're okay. Maybe they need a, you know, little resources, things like that. But as the level increases of need, we also can include things like, and I don't know if you all have heard, but there is a mobile or children's mobile crisis unit that can respond to homes where children are in crisis. We will have an adult mobile crisis unit as well, but I know there's been an issue in hiring. Also part of this alert, Marcus Alert, are the embedded counselors. And so in our community, we are lucky to have mental health providers that are embedded in our sheriff's office here in Fauquier. They also work with the town police in Culpeper. They are both in the sheriff's office and the town police, and they have been utilized so well, we're actually expanding the number of hours they cover. And so in Fauquier, they cover Monday through Friday, I want to say 10 to 6, but on 2 evenings now, the evenings that tend to be more busy, there's a second shift that will come on that goes 5 to 9 to also cover those. The other wonderful thing about those embedded counselors is when they aren't busy, they follow up on calls that have happened when there wasn't an embedded counselor on shift. So they are responding, making contact to maybe, you know, families of a person who police were called about an overdose or things like that. And so those embedded counselors are doing wonderful work. If you talk to Andy Marshall at the Fauquier County Sheriff's Office, he will tell you those the embedded counselor has changed the culture of his sheriff's office. Now, I have to tell you that we are lucky that we also have so many officers that are trained, CIT trained officers. So to have a department that already had so many CIT officers, have Andy tell me that the embedded counselor has further changed that, it's so much, that to me is remarkable. So you have those embedded counselors. And then I'm trying to see, I'm looking at my notes because I wanted to make sure I didn't forget anything about Marcus. The other thing that is happening, and I'm not sure how many of you all are aware, but Rappahannock Rapidan has opened the C Center in Culpeper. The C Center is a at no charge drop-in center. The only thing individuals are asked as they come in, they're handed an iPad and they just have to check, is this your first visit? Are you returning? And what county are you from? It has been amazing, the response that they have had. It is a true drop-in center where you can do everything from do your laundry or get a shower to attend AA groups, NA groups, coffee and conversation. They're quiet rooms. If you just need a place to, decompress, or if you need a place to connect, there are peer specialists there that will, connect and talk. If you're feeling, isolated, there are people and programs you can connect to there. And we're also lucky in that there is one of the emergency services people there. And so if the person is more in crisis, they can intervene. The neat thing that is also happening in Culpeper is that when the police come across somebody who in previous years might have, been taken to jail because of erratic behavior or something, they are able to call the C Center and say, hey, just to let you know, I found, I'm interacting with this individual. I think he might benefit. Can we bring him by or can we bring her by? And so it's been great for them as well. And I know that Rrcs is talking about expanding the program. Currently, Madison now has a site and they're hoping to bring it to the other counties as well. So we are looking forward to that. Other things that you all might not be aware of that we are working with. There's a program called Vmap. It is the Virginia Mental Health Access Program. I don't know why it's called Vmap without the mental health part of it, but anyway, it is a program. It's a consultation and education program for pediatricians and family care practitioners and nurse practitioners. It allows them, we are part of the Northern region, it allows them to call one number and have a consultation with a pediatric adolescent licensed clinical social worker, a pediatric adolescent psychiatrist, to get help with their own patients. We know that there is a huge dearth of mental health providers, and when we talk about questions in a second, one of those we'll talk about that. But the state of Virginia funds this. It is at no charge for any of the people who actually, call to take advantage of their services. And so we are working to make sure that all the pediatricians and primary care physicians know about this service. Piedmont Pediatrics is already on board, as is Warrenton Pediatrics. And so not only do they provide that information, but they provide educational opportunities for those physicians and nurse practitioners to get a better understanding of pediatric mental health and how to treat it. So fabulous program there. And I think I've talked about everything I need to talk about. Oh, one other thing that's happening, and I'm sorry, that was the most recent thing. If you all are not aware, Judge Cupp is in the process of starting a family drug court. And so we are in the application phase of that. And the family drug court is for those families who might be involved in the foster care system, to be able for individuals who have substance use issues to go to treatment instead of incarceration, to help try to keep those families together. So that is something we are working on putting together. Bridget? Oh, you're muted.
Thank you so much, Renee. That's all excellent information and resources, and we're looking forward to those new programs getting started. So now we're going to move on to the Q&A session of our event today, and I'm just going to bring those up so we can all look at them. We've got some excellent questions submitted, and anybody can answer those on the panel. You know, we're not going to be formal about who should answer them. If you have a recommendation or suggestion, feel free to chime in. So let me just pull up my screen here. And also, anyone who's attending, feel free to add your questions into the chat and we'll get to them as well. So our first question was, how are we coping with the lack of service providers in the area for immediate needs? We have heard from many referrals that either they cannot get in to see a provider, they cannot afford the fees, or the wait time is months or all three. And I think we've addressed some of that, but does anyone have a more comprehensive answer just to the specific question?
Hey, I know, you know, RRCS often gets people looking for services, and they've added that rapid access. And Ellen, you've been there, you can throw something in here too with that, but rapid access. And, you know, they, if there's an emergency that we've crisis services has stepped up big time with the, you know, numbers. You got the regional call center for one thing to get services in general, but also rapid access in the clinics. And you also have, you can still call a clinic number and like at 825-5656 and hit extension 7, and it'll take you to a crisis contact as well. But you know, we're trying to step it up and get people in to be seen and respond.
And on that note, I think also relying on groups like the C Center is really valuable.
Yes.
Because a lot of times, you know, especially if they're waiting for services, the rapid access process, though it intends to be rapid, still has a limited number of spaces available each day. And it's a first come for, I think you have to call ahead. But anyway, it can be a little bit frustrating because sometimes you can't get in when you need to get in. But helping people see the value in connecting to other resources, so many have been named here, it can be helpful. Just that the points of connection while they're waiting for other kinds of help, I think is really valuable.
I would second that as well. Second and third, that is, you know, in that in-between time, we've done a lot of referring to the more informal peer support, such as NAMI or the C Center. And then I also, you know, encourage folks to consider telehealth, you know, especially when we get calls from the community from folks who are not eligible for the free clinic, perhaps they have commercial insurance through their job. A lot of those commercial insurances already have partnered up with the telehealth platform. So I encourage them, if they're comfortable with it, you know, and they have the means to do it, to consider that as well. I can speak from our end, at least with one of our telehealth platforms, the time that we have with those providers are not set aside specifically for free clinic patients. So I'm kind of seeing what the folks in the community are seeing real time in terms of provider availability. And I can say that at least with one particular platform that wait time for therapy is still pretty significant. It may not be 3 months out, like trying to get face-to-face with someone in the community, but they're still, you know, looking at around a month. It seems that psychiatry appointments seem to be pretty plentiful right now, which is kind of the opposite of what we're used to. But I've noticed, at least with the general public appointments on that platform, that the wait time doesn't seem to be quite as long as the brick and mortar local community agencies.
The other thing to check out, if the person you are wanting to help is in community college, Germanna and Lord Fairfax both now have online access to telemental health and life coaching. And so it doesn't matter if you're only taking 1 credit or full-time or in their workforce program. Those individuals can get 5 counseling sessions a year at no charge to them. And also life coaching, nutrition coaching, exercise coaching as well. And that is unlimited. And I have to sort of give Lord Fairfax a pat on the back. Apparently, their students at Lord Fairfax are utilizing their online program more than any other community college in the state. So they've done a great job of rolling it out. I think the other thing that I wanted to mention is that the Vmap program also has care navigators. And so for individuals, young people who their physician, their pediatrician or, family practitioner has accessed the Vmap program, they can then refer their patient to the care navigators, and the care navigators will help them, coach them through it, and they will say things like, look, here's the list of providers. Yes, the list is long, but get on the wait list, continue to call back, and help them in that way.
Another program that I would mention that I just learned about actually at the National Council Convention is P-REACH. And so we've heard a little bit about the REACH program with physicians and psychiatric care, but there is a peer support for families, not necessarily for the individual in crisis, but for families who have a loved one with a psychotic disorder diagnosis. So it's psychosis REACH is what it stands for. And they do, it's an online program. I will have to do a little bit of digging. I can't find my slides and my handouts right now. But the family member could sign up online, and they do basically an education component where they teach about the diagnosis, and they teach the families ways to intervene with their loved one when they are experiencing a psychotic break. But then they also, on top of the education, they offer peer family supports as well. So they also are doing Zoom specific to that diagnosis. So that makes it a little bit different than what Kathy's offering at NAMI, because that's not diagnosis specific. But this is other family members and caregivers for a loved one with a disorder, a psychotic disorder diagnosis, where they have monthly or bi-weekly Zoom check-ins where they can kind of talk about what's going on at home and have that peer support in addition to the psychoeducation on the diagnosis with specific interventions to try.
Great. I had not heard about that P-REACH program. Thanks for sharing that, Shannon. Okay, so our next question. Let's see. Have there been any significant changes to school and community health resources, funding initiatives since the pandemic? I think we talked a little bit about the timely MD, and I know that Fauquier County Public Schools is getting ready to resume their youth mental health first aid training to all educators. Does anybody know of any additional programs?
Hey, I know Culpeper Schools is going to be doing their youth survey to collect some information. Plus, they've been ongoing with their gatekeeper training of staff each year, quarterly, and into the summer. But they get all their staff trained as well as that active shooter piece. But they have a prevention presentation about gatekeeper training, recognizing youth, and it's also good for the community to anyone in distress and how to link them to help. So I know they're going to be doing their survey.
NAMI Piedmont we've been trying, I know I've mentioned it's incoming, are ending the silence program for the middle high school level students, which is remarkable, but I cannot do it unless I have a peer age 18 up to 35, although I say 32 because they age out at 35, in recovery, able to stand up and that age level of a classroom to share their experience. It's only a 10-minute presentation, their part in it, and they get paid $60 a session or a class. So that's an incentive. But if I can find that program, we only have a online training when we're ready to hit the road with it it's different than the mental health first aid training. We go in and mostly try to hit, actually reach with information to reach their peers, the individuals with mental health concerns who have been calling peers, but they're actual classmates, peers, but it's in the seedling stage when they're not really feeling the mental health concerns yet, and we're the coaches and the teachers and the friends trained in mental health first aid would notice it, but the youth with the mental health concern is starting to notice it. It hasn't boiled over or snuck out of the, pocket yet where others can see it, but maybe they shared it with a friend on a lighter level that, I can't stop thinking about. But that's the purpose of ending the silence. And then we could hit stigma and maybe self-medication, because it starts a lot earlier than you think. Well, I think from your surveys it does, but especially with children with mental health concerns, if they know what's going on, then we can, keep them from going that direction. And we do, I can get a tape of that program too, the full thing, if anybody's interested. And we will present it to adults before we do the children so they can see it. Any questions about it? Okay. Find me a peer, please. I'm desperate. I've asked the C Center to look, so.
And so I think the other thing to realize is that, COVID was hard on everyone, but there are a couple silver linings from it. It did advance our telemental health by probably about 20 years, but it also brought mental health to the forefront of our legislative bodies. So we are seeing legislation come out both at the state and federal levels to help fund this. And so in addressing that workforce shortage, there are tuition reimbursement programs, scholarships, student loan forgiveness coming out in the mental health positions. And then the other thing that we are going to see come down the pike, but the settlement for, I'll call it like they call big tobacco, we'll call it big opioids for right now, is also coming down the pike, which might help fund some of those as well.
What is the local availability for Medicare recipients?
Minimal. Unfortunately, at least speaking from the free clinic standpoint, that's one of the biggest barriers that I encounter with our patients. A lot of our patients either age into Medicare or they receive Medicare because they have been receiving disability for 2 years. So a lot of folks don't realize when they're applying for disability that once they have been receiving disability for 2 years, that they will automatically be enrolled in Medicare as well. And there's an extreme drought of providers. And I don't think that it's because there are providers who are unwilling to see these individuals. It is, it's red tape. It's bureaucracy and red tape in terms of the credentialing that Medicare will reimburse for. They will only reimburse for certain, certain licenses. And it's been difficult to find those providers and keep those providers in our area to accept Medicare. So that, and a lot of Medicare in Virginia, I also have not been able to find where telehealth is reimbursed in terms of making, referrals that way as well. So at least for our patients, I'm having to do a lot of referrals out of our catchment. And, you know, and I'm just constantly outreaching to the folks over at Rrcs, Youth for Tomorrow, to find out if they've been able to get and hold on to a licensed clinical social worker who can bill Medicare. And even then that brings just, you know, they can only see so many folks. Caseloads are only so big. So, you know, there's a lot that needs to happen from, I think, on the legislative end that will open up access for individuals with Medicare. And also, again, kind of piggybacking off what Renee was saying in terms of how do we get more clinicians in our area, and especially those licensed clinical social workers. And I think the other side would be, and Renee, please help me because I can't always remember, is it licensed clinical psychologists that they'll reimburse for? Okay. Which are even fewer and farther between than the LCSWs. So it's challenging.
If somebody were not working with the free clinic, but wanted to sort of start looking in our community, the Mental Health Association's website has a mental health provider search engine, and you can specify under insurance, Medicare, and see who is willing to accept it. Then, of course, it will require you to call and get on wait lists and things like that.
I'm just going to pop that in the chat real quick.
People are probably familiar with the Psychology Today website, but you can do the same thing there and find insurance, people that take your insurance, but then it often lists people who are open to seeing new clients. So.
Yeah, when I first started at Mental Health Association, I thought that was one of the coolest features that we have. So definitely check that out. It's very useful. Okay, so our next question. So it's often necessary to travel considerable distance and to incur expenses that are beyond the means of many to receive effective support for healing from complex trauma. How can we as a community find a way to make effective treatment available to all? That's a great question. Any answers? I can mention that this spiritual care support network has a great variety of grief counseling and trauma-related free counseling groups, and many counselors available, and that's all free. And that's right here in Warrenton. And I'll pop that into the chat as another resource for people to check out. Anything else? Complex trauma.
I would, you know, want to, again, on a larger scale, speak to advocacy for, you know, sorting out funding for either integrated care coordination, because that's not something, you know, if a therapist wants to consult with the psychologist or things like that, you know, it's not always a billable service. So it makes it difficult, especially in an outpatient setting. So I think advocating for integrated care and for coordination between team members to be a reimbursable activity, but also to understand the value, again, of non-traditional ways of treating complex trauma, such as therapeutic yoga, you know, and reconnecting with your own body, mindfulness and meditation practices. And again, you know, how can we get insurance on board with that? Not everybody can afford to join a yoga studio. You know, how could we bring, how can we access different funding sources for those types of things as well? So considering non-traditional or non-formally professional, again, you know, type of environments to access that healing, ropes courses and adventure-based counseling through Verdun, those types of things.
Those are great, great thinking, great creative options. I hadn't thought of those. Thanks, Shannon. You know, so many of our youth are experiencing trauma, and it's trauma stored in the body. And a lot of discussion in some of our schools coalition is talking about just having kids to have more opportunity to be physically active. That's going to help a lot. So Verdun is doing great things in that regard. We have some questions in the chat that we'll get to in just a second. I want to get to these few on the slide if we can. Okay, when someone is arrested and experiencing a mental crisis, what services does the CSB provide at the time of arrest?
I can start this conversation because in a previous life, I was an emergency services clinician for Rappahannock, Rapidan. And so a little clarification on the question. And so when somebody is arrested, it's a little different for how the Community Services Board responds than if somebody is taken into custody. Okay, so if a family member or police officer comes across somebody who is experiencing a mental health crisis and they believe there is a threat to self or others, there's something called an emergency custody order that is ordered. And the police will take the person into custody and, usually they're CIT officers, so they're trained in that behavioral health. And then they will bring the individual to the crisis center in Culpeper. We are working on getting a satellite one at Fauquier Health, having a little trouble with hiring. But that person is then evaluated by one of the Rrcs emergency services clinicians, and it is determined whether or not they are a threat to self or others. And if they are determined to be a threat to self or others, the clinician goes with the magistrate, and the magistrate will then issue a temporary detaining order, which will basically put that individual into a hospital setting for 72 hours to help regulate what is happening with this crisis. Now, unfortunately, and some of you all probably know through the news media, hospital beds can be hard to find. And so it is sometimes the TDO will expire before a hospital bed can be found. And so they are working on that situation, but it is still continues to be difficult. The Rrcs will try to support them any way they can. The other thing, I mean, if you have somebody that you're talking to, we have people that call. I have to be honest here in Fauquier. If somebody says, I'm going to take my loved one to an ER, where should I go? I send them to Prince William, to the Manassas campus, because they have their own mental health unit there. So they will get direct treatment. I've had too many of our own community members sit at Fauquier Health for 5 or more days in the ER with no services. So even though it is out of our catchment, I would encourage them to go to an ER. Inova Fairfax also has a walk-in evaluation clinic. And so for people who don't want to sit in an ER, they can go to Inova Fairfax. And did that answer the question enough?
I think so. Yeah.
So the only difference is if the person was truly arrested or currently in jail, the difference is if a TDO is issued, they have to go to a secure psychiatric ward. And so it's even harder to find those beds.
I also know that they are bringing, the C Center is helping out with that. Instead of, people having to go to jail, they're able to go to the C Center and kind of chill out for a little while. So I've heard that that's helping. Let's see, next question. And we do have Felissa on the call, who is a peer support specialist at the C Center. So Felissa, feel free to chime in on any of this that if you know.
Yes, we have a de-escalation room, and I'm getting ready to go do a AA meeting in just a minute, so I'll have to get off. And we have a relaxation room as well. So these are places where people can come after these incidents and meet with a peer and be able to talk things down a little bit. So we have several instances of this actually happening, and people feel like they're being heard. Sometimes that's all they need. So it's been a good resource.
Thank you. All right, next question. Okay, what resources are available for patients to obtain medications for mental health issues in Fauquier other than a PCP? And are there any psychiatrists or prescribing psychiatric nurse practitioners in our community? And I know for sure that Renee has an answer for this.
I do. Just so you all know, Katrina White is a psychiatric nurse practitioner. She has been working with Piedmont Family Practice. She used to be there full-time, but now is part-time because she has hung out her own shingle with Apple Psychiatry. And I don't think she's full yet. So if anyone needs that access, I'll have that. I have her information on that resource list. I'll pop into the chat at the end.
Does she take Medicare?
Haven't asked her that yet, but I will. We can ask her. We have her number now.
Yeah, I know she did at Piedmont, so that's why I was wondering if that went with her. So.
And the only other thing, when we were at the national conference, we did hear something about psychiatric pharmacists. And so I'm still looking into that because they have prescribing ability as well. But I don't have enough information about them yet.
All right. Moving along. What resources are available for the elderly, specifically those that are homebound, and what resources are available for family caregivers? And I know again that Renee has the answers on that. You're muted, Renee.
It's funny, I was going to type information onto the other thing, and so I muted myself so you all didn't have to hear me type. There are lots of resources. If you all aren't aware of this document or this nice little booklet, Aging Together, put it together. It is the Regional Resource Guide for Older Adults. Not only does it have contact information, but it has like pull out pages that you can hang on your refrigerator, plus articles to think about as you're aging. We are in the process of Aging Together is in the process of redoing this. So if you aren't in here and know something that needs to be in there, contact Aging Together. Cornerstone Cares. I know Ursula is on this call.
Yes, ma'am.
Do you want to share a little information about caregiver support and elderly support?
Of course. Hi, everybody. Sorry. I apologize for the noise in the background, but I, like most, am working from home, but I'm having some work done at home. But I'll just share a little bit. Cornerstone Cares is a caregiver ministry, and our goal is to support the family caregiver. And one of the biggest things that we do is education for the family caregiver. We are actually having a session, a workshop that starts this Friday, Powerful Tools for Caregivers. And the other thing that we do is in-home respite. We know, and I know personally as a caregiver, we need a break every now and then. Caregivers need some support. The education is great. We need that, but occasionally we just need a breather, just someone to come and sit in. So we do have a team of volunteers who go out and sit with our family caregivers to give them that little bit of a break. It's about 4 to 6 hours per week as needed. And the other thing we do, we have support. So we do have support groups, virtual right now. We are slowly working our way back to an in-person format. And of course, if you have any questions, comments, or concerns, please let me know.
NAMI Virginia has just started an online senior support group. To get to that, you can go on to our website and they have NAMI Virginia, click there and then go to, well, you'll see it's online support groups, but that started up a few weeks ago. And there's also a senior loneliness helpline. If you want to put that in the chat, I don't know how to put things in the chat. I'm sorry, I'm not tech savvy, folks. It's 1-800-282-7035. But that's the senior loneliness helpline, and I believe that's for mental health issues only.
I wanted to mention too that Rapid Home in Rappahannock County is always expanding its services. There's a caregiver support group and lots of other services to help people age in place. I put their contact information in the chat.
Thank you, Ellen. And thank you, Kathy. And thank you, Ursula.
Mhm. The other thing to think about is if that elderly person is a veteran, Heroes Bridge also does visiting, which is fabulous. And all these contacts are on this resource page.
That resource book is my best friend. Very, very helpful.
I dropped a link to the resource book also in the chat.
Awesome. Thank you. All right, what are the best resources you found to support parents, specifically moms, find support and community? I think NAMI is doing great things in that regard. Are there any other like less formal support groups that anybody knows about?
Postpartum Support of Virginia is doing great work as well. And again, you know, for pregnant and postpartum moms, they have free support groups. I will drop, let's see, I will drop their website into the chat as well.
And there, I think someone mentioned the BotFin parent support, not a support group, but a class that's it starts on May 17th at the C Center. So it's one of the free offerings at the C Center, a 7-week class for parents on different topics. And the advice is to start at the beginning, but they're not going to turn anyone away who misses some and drops in.
Mm-hmm. There's also an organization here. They're moms clubs. And so for people who are new moms, being able to hang out and do activities with other moms, and you can just Google moms clubs. I also found out that there is a new national maternal mental health hotline that went live on Mother's Day. This is not a crisis line, but for any mother who needs support. And so I'll have that on the, it's 8339 Help for Moms, but I'll have it on that resource page as well. So I haven't had anyone call it yet because it's so new, but I'd love for somebody to call and see how supportive they are. And then for families that need a little more help, Healthy Families is also an organization that helps by doing home visits, helps with parenting techniques, helping to sort of redesign the family. Redesign is the wrong word. Reform that pattern that's happening in families so that they are more positive and productive and supportive of each other.
Excellent. I think that latest question and these answers are bringing home the real purpose of this is to kind of also talk about things that we can do in our home and our workplaces on an individual level so that we don't allow people to get to those crisis, that crisis level. And a lot of it is kindness with ourselves, kindness with each other, connection, connecting with youth, paying attention. I know all of our workloads are very, heavy, and maybe sometimes we just need to advocate with our bosses that, I'm working too much. For my own family's mental health, for my mental health, I need to take a step back. Those are all, it's all interrelated. So just an awareness of that is very important.
Hey, I'm going to encourage that gatekeeper training too. We can watch out for each other. And it doesn't mean everybody's suicidal. It means somebody's in distress, needs some help. It's a great way to support anybody. And at the same time, you might find somebody who really needs some help desperately.
Yeah, Alan shared these great Balancing Life videos in the chat, and they're great things that you can add to your training for your organization. And let me see if there's any other questions. Does anyone have any other questions that they want to pop in the chat, or has everybody had all their questions answered?
I did see a question in the chat earlier, and I'm trying to remember who said it, but wanting to know if there could be any discussion about narcissistic abuse.
Yes.
Yeah, Ms. Cadence was asking if there could be some conversation or resources surrounding that.
I shared that I don't know that SAFE, I doubt that they specialize in narcissistic abuse, but they are a wonderful resource for domestic violence. And I'm sure this is not an uncommon area of domestic violence. So they would be a great resource for any kind of abuse issues.
And Felissa, does the C Center offer any of the like relationship support groups or anything that would help with that?
Not that I'm aware, other than what's already been, but we do offer just general coffee and conversation where people can talk about some of these things. Sometimes people just need to have someone to listen to them, and so we start there. But other than that, not that I know of, but I can find that out for you. It's a great suggestion.
Fauquier County Social Services also has a grant-funded program for domestic violence and sexual assault support. You don't necessarily need to be trying to get out of a situation. They're going to meet you where you're at and give you whatever resources you need to be safe and get the support you need in that moment. And I do also know that they offer, again, peer support groups. It's not specific to narcissistic abuse, but again, as Ellen was saying with SAFE, I think that because that is not an uncommon situation, that I think that could be a very valuable resource as well. Renee, I don't know if you could add that number into your Word document. Okay, thank you.
All right, thank you so much, everybody. I think not only have we talked about all the different approaches and things that we can do in our home, but we are developing a great resource list that we'll be able to share with everybody. So in closing, I just want to say we are a community. We've done this, throughout the session, but just continue to think of ways we can improve mental wellness in our homes, schools, and workplaces to foster a more kind, caring, and accessible future for all. And then thank you to Alan for helping me pull this together. And thank you so much to all of our panelists. And thank you all for participating in this discussion today. And most importantly, thank you to all our mental health professionals for the hard work that you've done throughout the pandemic and now helping us address the ripple effects of the mental health crisis. And addressing the shortage issue, if anyone's interested in a career in behavioral health, reach out to learn more about scholarships and incentives available to Renee at Renee R. Norden at MHAFC1.org. Does anyone have any final comments to share?
Thanks, Bridget, for doing a good job facilitating the meeting and event today. You did a wonderful job.
Thank you.
And the resource list is in the chat.
Wonderful.
Let's see.
Again, I really appreciate it.
You guys are a great group. Love it.
Renee, do you have any final self-care advice?
Here we are ending 8 minutes early. Remember, schedule till noon. So you have 8 minutes, and this 8 minutes, I do not want you, when we hang up, when we close this meeting, to go get on your laptops or go do something. It is beautiful outside. Yes. Go take a 5-minute walk. Go you don't even have to walk. Just go and bathe in the sunshine. Activate that vitamin D. Do something in the next 7 minutes that feeds your soul.
Great idea.
Thanks so much for attending.
Thank you, everybody.
Good to see everybody.
Thank you, guys. Take care.
Bye-bye.
Bye.
Lisa, I know that you just put something in the chat. There will be a recording and we will send out information about it.
Thanks so much. I was in another meeting and couldn't get there and missed